In this lecture, we will discuss about pregnancy and exercise. We will discuss how does exercise affect the pregnancy and doing exercise during pregnancy, and what are the beneficial effect of exercise for a normal housewife or a professional athlete. Pregnancy and exercise. Pregnancy is a normal physiological phenomena where one sperm and ovum fertilize and they develop into an fetus and grow in the womb of a woman inside the uterus. So it's a normal physiological phenomena. It's not a disease. It's a natural phenomena. So one should not be considered, or one should not be treated pregnancy as a sportsman who is a high performance athlete. She just conceived. So sometime two different headings: maternal health and the fetal health. So first we discuss about the maternal health and the pregnancy. As the pregnancy goes, or sometime pregnancy diagnosed after term of his or first trimester of the pregnancy, or as athletes they are used to delay their generally there because of excessive exercises. And I just brief you about their delayed menstrual cycles. They don't know about it's a natural delay amenorrhea or it's because of pregnancy. Sometimes they diagnosed as a case of their performance is deteriorating, and then a doctor or they themselves has checked did a pregnancy test, and they surprised with the pregnancy, or it might be a planned pregnancy. So first 3 months one has to be extra careful, and as she is a professional athlete, so she can continue with her exercises up to second trimester. But after that, if the pregnancy is non-complicated, like there is no discharge, there is no answer class cervix, or there is no incompetency of the cervix, or issue to the child, or any other issue to the fetus which is affecting her or his growth inside the, so one has to be periodically check the growth of the fetus. And as the fetus grow in size, the body biomechanics also changes, and the load over the lower back of or the lower lumbar vertebra and the sacrum region increases. So there might be chances of lower back ache related issues or lower back pain related issues. And if now we discuss about the fetal health, if the fetus undergoes hydration or dehydrated, increase temperature, increase in body temperature, the chances of neural tube defects are also be there. So when a athlete has conceived, so she has to be extra careful about her training and her kid also, her fetus. So she should not be advised doing in a hot, humid environment where the temperature goes quite high and the chances of dehydrations are quite high. So the athlete has to keep in mind doing training in cooler, colder environment, so those damaging effects doesn't occur on the kids. And she has to maintain her proper diet. She has to take extra 300 to 400 calories as or more as per the advice of the doctor, because that growing fetus also required some energy apart from whatever energy she required for her strengthening and her body. Apart from that, she also required additional energy or energy extra calories for the growth of the fetus. And in the when we talk about the housewives, those who are not doing any extra athletic activities or like that, in those ladies, doing exercise during pregnancy is quite beneficial, and doing exercise at that particular time, it improves their gestational health also, and it relieves from certain disorders which generally encountered, like gestational diabetes, preeclampsia, or lower back ache. Doing these exercise or doing exercise during pregnancy improves their musculoskeletal strength and the water retention also reduced, and they have less chances of gaining extra weight as compared to the females, those who are not doing exercise during the pregnancy times. And the health of kid also be improved, like if they do exercise, the circulation of the body is well regulated, their energy intake will also increase, and the child will also well nourished. I just told you about these fetal injuries, what occurs in the female athletes when if an elite athlete is doing exercise, so how it is going to affect the health of a fetus. And during this pregnancy, those who are involved in close combat sports, or they should avoid these sports where a close combat or close chances of close contact is there. So it might affect the health of a fetus. It may lead to the premature delivery also because of high impact injuries. Like I just mentioned, intrauterine growth retardation, because if the athlete, because of performance anxiety, if she is not eating well, or if she is continuously doing exercise in a hot and humid environment, the child may be growth retarded and a fetal may be go under distress, and there might be chances of excessive temperature. The neural tube defects are also may be there. So now we discuss about the advantages of exercise during pregnancy. The advantages I just mentioned you, like in a normal lady who is not an athlete or athlete, there are less chances of gaining extra weight. And those who have not done exercise before the pregnancy but they are doing exercise during this period, they are betterly able or betterly cope up the labor pain and labor issues. I just mentioned there is a less chances of gestational diabetes and reduced chances of preeclampsia also. And there are certain things or certain diseases where the list is quite extended, but I have just noted down a few diseases where absolute contraindications are there and relative contraindications are also there. These are heart diseases. If a lady is suffering from heart disease, exercise should not be. If placenta previa is diagnosed after 26 of weeks, that pregnancy, that exercise should not be allowed. If cervix is incompetent, like there is a history of leakage of amniotic fluid or a bleeding in between the cycle, in between the during the pregnancy, then the exercise should not be continued. And in the multiple gestation, like when there is a twin pregnancy or more pregnancy, the exercise is as dangerous. It may induce early labor also. If there is a ruptured membrane or amniotic fluid is leakage is there, so exercise should not be conducted. Anemia is a relative contraindication. If the anemia is improved, then one can do exercise. Why anemia is a relative? At the time of anemia, if already the body demand of quite high and the heart rate is quite high when the patient remains in anemia, and if he again exert more, though the chances of fetal distress may be increased and the ill effects on the heart failure may be, chances of heart failure may be increased. Morbid obesity is again a contraindication, but it is a relative. If he start doing a little bit of exercise and if she is comfortable, and later on if she is able to bear her own weight, then it should be allowed, and gradually it is to be in a progressive manner. Obesity, morbid obesity, and if she conceive, it's already a prize pregnancy and extra care has to be provided during this pregnancy. So these are the absolute and relative contraindications, few of the examples. The list is quite long and it can't be covered in such a short duration. So in the next week, in the next lecture, we will study about the types of exercises and their benefits. Thank you.